My name is Janet North, and I'm here to talk about health disparities and cardiovascular disease, an exploration of a historically Black community in Baltimore. We will begin with an exploration of the Midtown Edmondson community, followed by the main health issue, which will include how it was obtained, the results, what was learned from them, and the importance of your role as a stakeholder in this community. As of 2016, the CDC reports that heart disease is the #1 cause of death in the United States and stroke as the #5 cause of all deaths, both of which fall under cardiovascular disease. Similarly, the CDC lists heart disease as the #1 cause of deaths in Maryland and stroke as the #3 cause. Heart disease and stroke are ranked the same, #1 and #3 respectively, by the Baltimore City Health Department. When the CDC data was drilled down to show the differences in the mortality rate of cardiovascular disease in the country and in the state of Maryland by race, Black and white, it showed that there were significant differences between the two. With the local rankings of heart disease as #1 and stroke as #3, the current focus will be on the rates of cardiovascular disease within a predominantly African American community, Midtown Edmondson, or MEC for short. As many of you may already know, MEC is a struggling community with a rich historical heritage located in a centralized area of Baltimore City that currently teeters on the brink of desolation. However, its potential for the revitalization of the community and its residents is hopeful. In order to fully understand the urgent need to address this health issue in this community, a brief overview of the perceived socioeconomic factors that impact the health status of the community will provide a strong foundation upon which each stakeholder will have a clear understanding of the situation and the roles you will play. For Midtown Edmondson, it was important to revisit the past in order to get a clear picture of the present as we work towards the successful future of the historic Midtown Edmondson community. The Baltimore City Health Department suggests that before discussing health in Baltimore, disparities due to racism, structural discrimination, poverty, and historical intentional segregation must be addressed. The New York Times suggests that the acceleration of the urban decline and ghettoization preventing generations of Blacks from acquiring wealth in Baltimore is due largely in part to this system, which trapped African American families in dangerous and dilapidated communities even still today. Some of these communities sit in isolation amidst bustling surrounding neighborhoods, awaiting for support to trickle down to them. Midtown Edmondson community is one such community. As stakeholders, you can offer the residents more than a trickle. Together, you can offer them a fountain of hope. Unfortunately, the city has sectioned this neighborhood out, therefore splitting its data between 3 adjacent neighborhoods, leaving MEC with no data of its own. And with no data, it is close to impossible to receive support in the form of resources. So before I share the results, let's take a look at how this data was obtained. And as you can see, there were 4 methods in which that took place. First, there were 4 focus groups with approximately 30 participants. Second, how community partners conducted 300 5 to 10 minute surveys. Third, we had in-depth interviews. And finally, it was just a collaboration of different organic conversations that were had by residents and community leaders. So what was learned can be put into these 2 categories: community health and community assets and needs. For community health, residents stated that heart problems were the #1 health issue to their community. The surveys revealed that 1 in 5 residents needed health care but didn't get it due to a lack of resources. There was also a significant amount of residents who used tobacco, with 68% of the 36 to 55 age group and then 57% in the 26 to 35 age group, along with 54% in the 18 to 25-year-old age group. For community assets and needs, 33% of the residents felt that the main asset was people. 58% felt the greatest need was stores that offer healthy food choices. The remaining 42% stated the need for public services and resources in order to feel comfortable and safe in their community. Because MEC is lacking data independent of other neighborhoods, data from the Sandtown-Winchester community will have to be used. This is where a large portion of the MEC data has been conflated. However, an effort by all stakeholders should be made to continue obtaining more data from MEC. The perceived socioeconomic factors that impact the health status of the community are the location of the community, which has been isolated by poorly planned and/or discriminative development, and disinvestment, causing a devaluing of the properties and increased poverty. This issue could be best served by a collaboration between local governments, community, and health advocates to ensure feasible community planning that encourages physical activity, the construction of affordable, healthy homes, and provisions made for effective public resources and healthy food sources. It is essential that healthcare providers are actively engaged in the prevention and treatment of cardiovascular disease by raising awareness of the compounded risk factors for this population, in addition to testing for early disease detection and access to health care. And finally, since rumors are underway about plans for redevelopments in this community, researchers are tasked with the collection of tracking health, socioeconomic, and environmental data. So the question is, how do we get the message out? And the answer is narrowcasting. Narrowcasting is the use of highly focused messaging targeted for a specific population. The specific population being African Americans in Midtown Edmondson, and the message being that while data shows that African Americans are 25% more likely to die from heart disease and stroke, they have the power to change their estimated health outcomes by first knowing their risk, and second, by modifying risk behaviors like regulating blood pressure, eliminating tobacco use, and by maintaining body weight via a healthy diet and increased physical activities. Diet, however, is one of the key things that can be changed that will impact all other cardiovascular risks. The Community Walkthrough Theater in MEC is the perfect platform for narrowcasting. It is an innovative project that will be useful to inform and educate residents in Midtown by providing opportunities to create and display creative community health messages on a screen located in a high-traffic area using a high-powered projector to display the information. To achieve these results, it will take teamwork consisting of multiple sub-teams willing to take the lead in various areas. The belief is not only can this one bustling historic community be revived, but it can far exceed what it was in years past. And by having this wraparound of resources, we will most assuredly see a decline in unhealthy risk behaviors, an incline in healthy behaviors, and subsequently a decrease in the rate of cardiovascular disease and an increase in healthy outcomes overall in the Midtown Edmondson community.